You've asked about Polycystic Ovarian Syndrome, or PCOS, and today I am delivering. The name is the definition. We have poly means many. Cystic is cysts, so basically fluid-filled sacs. Ovarian is in the ovaries that are being affected, and syndrome basically means a collection of symptoms, as we are going to see. It's the most common cause of hormonal issues among young girls, or even a biggest cause of infertility, menstrual irregularities, and things like this, because it is common in this age. So some girls, it can even cause heavy bleeding, or you find that the type of bleeding that you have is anovulatory. Simply means that you do not ovulate, or you have periods where you ovulate and others you just do not. Now, PCOS is created with these things. It has a triad of things that we use to diagnose. So for example, someone will have multiple cysts. Although some patients do not have them, they can have symptoms that attribute to male hormones or male characteristics. So she will have things like having hair in places whereby it's men who have them. You have patterns of hair growth that are dysregulated, things like having baldness, you have hair on the chest, you have hair in the back, things like this, which are mostly seen in men, but she does have them, especially these, also the little beards that be on the chest as well, and she'll have basically male features. I don't know if most of you watched the video on menstruation. I talked about how the menstrual cycle happens right from the brain to the ovaries to the uterus, and when it all comes out, the blood. There is a hormone called GnRH, or gonadotropin-releasing hormone. It is the hormone which is the initiator up here in the brain, and it starts to send impulses. So the GnRH is produced, and it causes the release of two hormones called FSH, or follicular stimulating hormone. Always think about it like the egg stimulating hormone. And then we have the LH, or the luteinizing hormone. Now, it is thought that in PCOS or PCOS, the patient or the girl child or the female begins having a dysregulated production of GnRH. GnRH is produced in a particular pulsatile manner, like it's just like it's a tip, tip, tip. So if it just powers at once or has like a different pulse, you have dysregulation of these symptoms. So it ends up resulting, so it has been thought that it results into, because of that dysregulation in how it is produced, there's a decreased production of FSH, or the egg stimulating hormone, which is what we need to ovulate, and instead she has more of the luteinizing hormone, or the LH, and the LH ends up resulting into more production of male hormones as opposed to the female hormones, which is why we have difficulty in ovulating, and yet we bleed a lot. Sometimes you'll find she has periods of not bleeding for like 6-8 months. When the bleeding comes, it is abnormally heavy, it is too much, she has spotting, things like this. So that is basically how I can describe PCOS to you. Now, what are the causes or the risk factors? It is not very clear what the cause is, but it has been highly attributed to genetic factors. If you've had like a mother or a sister that has had these issues, chances are that you are at risk. It's also attributed to lifestyle and environment, also attributed to things like obesity. Or when it comes to being obese or overweight, obesity can attribute to PCOS, but also PCOS can attribute to obesity. So those two types of things. These are some of the things that have been attributed to causing it, but these are just things that we call risk factors. Anyone can get this condition right from young girls. There's some girls when you find the period delays to come. Before even she ever sees her period, she's like 12 or 15, the period delays to come, not knowing that she actually did have this condition called PCOS. The signs and symptoms for a PCOS: we have irregular bleeding. Like I said, we have male features of increased testosterone or androgens. So you have things like male pattern baldness, you have hair where you have no business having that hair, things like those. Another thing that we tend to have is excessive weight. Now, the problem with PCOS is that it comes with other features that just do not make the situation any better. So excessive weight, obesity comes into the picture, diabetes, cardiovascular diseases, high blood pressure. Not to forget, if you're having already this amount of issues, it's easy for you to get mental issues like depression and anxiety. What's happening to me? And things like those. Another thing that we tend to see a lot of in PCOS cases is infertility. The reason as to why we have infertility is because, again, I said, because the system has basically been hormonally hacked. So ovulation is not really happening. So these are types of the things that we see. Now, if you do present with such symptoms, it's important, one, it's not saying that you're not going to have children. It is saying that infertility tends to be something that happens with these. However, this is something that is manageable. What we do with PCOS is that it's not medically curable, but what it is that we do as health workers is that we try to put these symptoms at bay as much as we can. So when we put the symptoms at bay, you're also able to optimize fertility. Now, one thing which is the cornerstone of the treatment and the management of PCOS is lifestyle modification. It has been reported that up to 5% of weight loss can aid to help the ovulation to occur and help improve fertility naturally. So you find that if you start working on your lifestyle modification, lose weight, just be more energetic and things like this, it tends to contribute a lot more to the betterment of these symptoms. Who is at risk? At risk is anyone who is female, which brings us to the treatment options. So our treatment options are based on, one, do you have symptoms? What symptoms do you have? Are we managing excessive bleeding? Are we managing the other symptoms? Is it the hair growth that's a problem? That is how we approach it, of what is the issue it is exactly that we are trying to handle. So if it's an issue of irregularities of the menses or things like this, we tend to use other things like hormonal therapies, combined oral contraceptive pills, birth control pills, but they're used in a particular way to try to help you in this process. Then they are withdrawn and then restarted again in a particular sense of which your doctor will discuss with you. The other treatment option that we have is metformin. This is basically an anti-diabetic. Why? Because PCOS has been highly attributed with diabetes. So metformin, what it does is that it helps to increase the sensitivity of the cells to insulin, so then you get out of that particular case of being of having these issues of diabetes as well. The other options are especially if you are trying to get pregnant. Now, if you're a young girl, you're not trying to get pregnant, you don't need to concern yourself with those issues, because PCOS doesn't guarantee actually infertility. It doesn't mean that if you have PCOS, you can have sex at random, that you won't get pregnant. It is not a birth control disease, okay? PCOS is not a birth control disease. PCOS simply means that you may have difficulty, but this you can only get to know when it is now that you're trying to have a child. If we assess a cause of the infertility and it has been attached to PCOS, then you're able to get more assistance. I will keep saying this, that when I am here, I am teaching you as your teacher. That's a health educator, and not as your doctor. When you come to my consultation room and you are my patient, we start going through these things. And what you do is, when you are unwell, go to your doctor. Let them customize a plan for you, because every patient is different. Diseases don't read books. They just happen. So we need to customize a plan that is meant exactly for you. But the cornerstone of PCOS management is and will always be lifestyle modification. You will highly benefit from a clinical nutritionist to be able to guide your process, because they basically guide on lifestyle conditions and treatments and plans that you can do and change with food. So anyway, if you have PCOS or any other conditions that are like this, do not worry, do not be dismayed. We're not the first, we're not the last. And another thing is, that is why we are here, to make your processes better and to guide you and support you. If you don't feel supported, go see your doctor, go see your healthcare provider. Let them guide your process. The point that I do here is to be able to empower you and teach you, so that you are not confused by people or misled by people that are not really having the right intentions at heart. We are all different. When you are unwell, a plan is customized for you. You don't say that this is what worked for this person, so it should work for me. That's not how it is. That we work because our bodies are generally different. Otherwise, I hope you have learned something about PCOS. Share this video with as many people it is that you can find that would like to learn from it. Follow my YouTube channel. It has the longer style videos will all be on my YouTube channel. My Instagram has more stories. When I'm not posting actively, Instagram is where we tend to interact a bit more on stories, almost on a daily basis, probably maybe like bi-weekly, but we tend to interact a bit more there. So that is it for today. Otherwise, class dismissed.